My name is Darren and I work for the Spinal Injury Association as a specialist nurse. With the current coronavirus pandemic, I just want to take a little bit of time to talk to you about the importance of infection control. As we know, the government have decided and advised the population to stay at home, self-isolate, shield, unless you are either working or need to travel for essential shopping or essential needs, or for health reasons or exercise. If you do leave the home, the advice is to stay at least 2 meters or 6 foot away from people at all times, and wash your hands as soon as you return home. And although this is difficult, this also includes meeting up with other people, even your friends and family. You can spread the virus even if you don't have the symptoms. Coronavirus can be spread person to person, usually by close contact, hence the government's advice of being 6 feet or 2 meters away from each other. This could be from physical contact such as handshaking, hugging, but it also can be from coughing, where respiratory droplets in excess of 3,000 droplets for each cough are dispersed into the air. It can travel far and wide and land on any surfaces and even be inhaled. When it lands on these surfaces, it can live there for quite some time. So if you are going to cough and sneeze, the advice is, if you can, use a tissue, catch it, bin it and kill it. If you can't, it's in the crook of your arm, and obviously wash your clothes thereafter. This is the reason infection control is really important at this worrying time for everyone. Hands are the most common way of spreading microorganisms. Therefore, hand hygiene is recognised as being the most effective way of controlling infection. The World Health Organization states that clean care is safe care. So please, wash your hands regularly. And the best methods are soap and water. Washing for a minimum of 20 seconds. If you should leave the home, beware of the risk of the virus being anywhere. Try not to touch your face during this time, especially around your nose, mouth and eyes. This is something that we all do automatically, continuously. But be aware, these areas are a route for infection to enter our bodies. On returning home, hygiene again is of most importance. Washing your hands, but if you're a wheelchair user, as well as washing your hands, use antibacterial cleanser to clean your wheels, to the rims of your chair, the arms of your chair, and anything else that you may have touched or may have been touched on the outside world. That includes your pushing gloves. Make sure you wash your pushing gloves. The virus can live anywhere. If you have carers coming into your home, this advice remains equally as important, especially before and after any interventions. This, of course, is something that should be done anyway, and the use of personal protective equipment or PPEs, where necessary, should be used. There may be a need to wear masks both to protect yourself and the staff member as well, or the carer themselves. Within your home, surfaces that are touched frequently should be regularly cleaned down with antibacterial cleanser. This again just reduces any risks that may materialise. As for your spinal cord injury issues, please continue with all your usual interventions. Know your own cares. Make sure that your bladder, your bowels are running fine. You're not changing any aspects of that. Make sure that you're drinking plenty and eating a healthy diet. and the SIA also have a helpline number of 0800 980 0501, and we're here to help and advise in anything that we can possibly do.